But now is the time around there, our third thing of the list. We want to confirm that this dog has a dilation or does it have a volvulus. And the classic approach is to take a right lateral radiograph, and this will help us determine if the patient has either of those diseases. So I think it's useful just to mentally picture why we want to do a right lateral radiograph. So the dog is lying on his right-hand side. So we have right side down here. Here's the film plate here. Now in a normal dog, the pylorus will be on the right-hand side, and it will be invisible on that radiograph because it's full of fluid that has by gravity fallen down to the right-hand side. And the air cap will be up the top here. Okay. Now, when we have a torsion, the pylorus is moved a variable amount. Okay, the pylorus is now somewhere on the left-hand side, or it might be somewhere in the middle. But classically, it's going to be full of air. So if we are in right lateral, and we can see the pylorus on our radiograph, something's not right. Okay. Because this picture tells us the pylorus should be invisible, and if we can see it, something's not right. And sometimes we will see this compartment line because we're seeing the pyloric antrum, so we can see this compartmentalization. So that's pictorially just what we do. So what I want to ask everybody is, do we think this dog has a gastric dilation? Do we think it has a gastric torsion? Or we're not sure? Okay, it looks like, yep, so the results coming up. So, okay, that's not, it's sort of changed as we were going, as more people thought about it and voted. But if we go back to what we were just talking about, so we've got, I don't know if everybody can see that, we've got just over 2/3 of you saying this is a simple dilation, and that would be correct, I think. And the rest of you were thinking this might be a torsion. So if we go back to the original slide, the previous slide, all I can see here is a large gas-filled fundus, gas-filled stomach. Sorry, not a fundus, a large gas-filled stomach. We can see the duodenum coming out here, but I can't see clearly a pylorus. It's going to be down here somewhere. So I think this dog has a simple dilation. All right, Alison, second question. What about this one, people? This is a right lateral radiograph. Clearly, this dog has got into the food bucket and has massively engorged himself and is presenting with dilation. We could debate whether this is simple engorgement or whether this is dilation, but is this dog's stomach in a normal position? And can we tell from this radiograph? Okay, that's great. So yes, we've got about 3/4 of you who have said this is definitely in the right place, and I would tend to concur. I think there's room for some doubt, and I think so that's acceptable. So what if we don't know? You know, there's a reasonable chance that we could take this radiograph and be perplexed. We can see a whole bunch of food. We cannot see any gas at all in this dog. He has eaten so much food that his stomach is absolutely full. There's no room for anything, and he's just feeling absolutely rubbish. So if we don't know, let's take a left lateral radiograph. So if we take a left lateral radiograph now, if we go back to that slide, the pylorus is now uppermost. So the pylorus is now up in the air. So if there is any gas in this dog's stomach, it should hopefully blip through all of that food, and the pylorus should become visible, and now she blows. Okay, so simply by taking 2 abdominal radiographs, we can be confident that this dog's stomach is normally positioned. It's clearly full of food, but it's normally positioned. We can relax a bit. We don't have a volvulus, and we just need to manage this very intense engorgement. So that's really, really important. And then finally, this dog clearly has a torsion. We've got this lovely demarcation, compartmentalization going on. So here is the pyloric antrum, and here is the pylorus. Okay, full 360-degree volvulus, we'll often see the duodenum coming off down here as well. So a nice, there's a whole range and a whole spectrum of things within that. But if you focus on where the pylorus should be, is it full of air or is it not, then hopefully that will improve your diagnostic acuity.